Well, Canada's Chinese population has been especially hit by the coronavirus information and misinformation. Here to help us understand just how to navigate this in the Chinese community in Canada and around the world is Richmond Hill Member of Parliament Daisy Wai. And Daisy, you are an Ontario Member of Parliament.
Yes.
What's your community going through?
Our community is suffering heavily from it. I am supposed to go to different kind of Chinese New Year events. I would say about 2/3 of them are canceled.
What is the economic impact of that?
It is serious. When I say 2/3, those events, they will have 500 or maybe 800 people. And can you imagine, they have all the food prepared, they have all the manpower. The Christmas, like the Chinese New Year's time, is almost like the Christmas time that we have here. So if you have all geared up for the Christmas thing, and then all of a sudden everything is canceled.
So 2/3 of your Chinese New Year events, and I've seen your schedule, it's daunting.
Yes.
All of a sudden these things are all canceled.
Yes. Say for example, this afternoon I'm supposed to go to one that is organized by the radio station for a Chinese New Year event for the customers. It's just canceled. And I'm sure it must be like 300 people.
So there's an economic impact.
Serious.
Serious economic impact. How are you going to turn that around? Or how do we turn it around?
We will just have to encourage people. Actually, yesterday, together with the Ministry of Health, we encourage people that we are at low risk in Ontario and in Canada.
Okay, let's just take a pause on this because you are commissioned by the Government of Ontario to speak on behalf of the Department of Health. Low risk?
Low risk, very low risk.
Define that a bit more.
If we see the results from the influenza, it can be more serious. And that's why we have been doing a lot of vaccination for people ahead of time.
Okay, so that's on the influenza. We just had Dr. McGeer on this show explain we don't yet know. And I think that's the worry about coronavirus. We don't know if it's going to get worse. What do you say to that fear?
We are really seeing everything, measuring all the numbers all the time. We also make sure that we gear up in the healthcare system, gear up everything for it. And if you see, right now we only have 3 cases in Ontario. Out of the 3 cases, 2 of them, only 1 of them are in hospital. 1 of them has already been out from the hospital. The other one is so minor that it's just staying 14 days quarantine. So it's not that serious. The risk is really low, but we're overreacting so much.
Let me talk a little bit about overreacting because there's been far too much misinformation on social media, a lot of misunderstanding, a lot of Chinese school children, local businesses being affected by this. Take a look at some of the social media boards that we've pulled just as a sample. What's your thought on this when you see, here's one where they're saying people are literally dying in the streets. Here's another one where they're saying parents are abandoning children at airports because the kids are sick. Totally false. What's your impression here that's happening?
Some of the information that we see in social media, they are not true. And some of them is overreacting because they see a lot of cases in China. China, especially in Wuhan, that is the place that we do have challenges. But Canada, we have gone through all the precaution, and we also check all the people coming in as well. We do not check it like the same way that Hong Kong checked it, but we have everything tracked. And the results is telling us that we do not need to overly concern about it. Because when we do, we have other problems, which is a lot more serious, like the economic impact it will do on those businesses.
Thank you for liking, commenting, and subscribing. What do you think about today's topic? Let us know in the comments.